If you have made the decision to go ahead with knee replacement surgery, you are anticipating taking short-term pain for long-term gain. Many people, however, underestimate what is involved in a knee replacement. While a hip replacement surgery is very well tolerated, even in the immediate short term, people require very little pain relief and often have quite minimal physiotherapy. A knee replacement surgery is much tougher on the patient. Immediately after surgery, you are often feeling quite good, as nerve blocks have become a general standard of care and most knee replacements are done using a spinal anesthetic. This provides relief in the hours to roughly a day after surgery, and under certain circumstances, the nerve block can even be left in for several days. However, once these stop working, the pain can become quite intense and medication needs to be taken to control it. Catching up to significant pain is much harder than controlling it as it builds. For this reason, given that pain medications take about 45 minutes to work, you should take it at the beginning of symptoms. Otherwise, you can end up behind the 8 ball. We know from extensive experience that at 2 days after surgery, pain is normally at its maximum, and very few patients, even those in their 80s and living independently, are still in the hospital at this point. Knee replacement surgery involves a cut across the front of the knee and is typically in excess of 6 inches long. Given that it crosses the front of the knee, it can have lifelong effects on pain with kneeling. A small nerve crosses just below the kneecap, and essentially everybody who has had a knee replacement has a numb spot on the outside part of their knee just below this level. As the knee is held in place by ligaments that are a fixed length, it cannot be lengthened or shortened with a knee replacement surgery. However, if you have a significant deformity before surgery, your leg can appear functionally longer afterwards. This can be exacerbated if your other leg has the same deformity. It's important to note that as the ligaments are a fixed length, the metal and plastic components can cause a clicking. This is perfectly normal and should not be painful. Aside from the cut on the front of your knee, normal changes to your leg in the immediate time after surgery can include swelling and inflammation. Inflammation is a normal part of healing, and it's how the body fights infection. As such, many of the normal findings after surgery can be confused for infection. A leg that is large and swollen with a moderate amount of pain is normal up to and beyond 3 months after surgery. If you are concerned about infection or blood clots, you should talk to your surgeon's office. Getting antibiotics from your family physician or in an emergency department or walk-in is not recommended.